name is Jessica Pittman, and I'm going to be your student nurse for today. How are you doing?
I'm good. How are you?
Good. I'm going to provide privacy, and I'm just going to wash my hands, okay?
Okay.
All right. And can I please have your name and your date of birth?
Kaylee Nelson, 8996.
All right. And Kaylee, are you allergic to anything?
No.
Okay, so what we're going to do is we're going to start and do a physical examination of your head, your neck, your heart, and your lungs, okay? And so I checked your health history before we came in.
I just can't hear you very well.
That's all right. I checked your health history before we came in, and now I'm just going to do a general survey of her so she is alert to person, place, or time. So where are we right now?
We're at Germana.
Okay, and do you know what time it is?
No, probably like 11.
Yes, okay, it's 11, yeah. And then do you know what date it is?
March 2nd, or is it the 1st?
It's the 2nd.
Okay.
Okay, so she's alert to person, place, and time. And you're talking to me, and you're sitting upright. You know, there's no need to do the Glasgow Coma scale because of that. And we don't need to do a mini mental exam because she's understanding what I'm telling her, and she is talking to me. Okay, so before we begin, I'm just going to list off the cranial nerves, and it is going to be the olfactory, the optic, the ocular motor, trochlear and trigeminal, the abductans, the facial, the acoustic, hypoglossopharyngeal, the glossopharyngeal, the vagus and spinal, and the hypoglossal. All right. So the first thing that we're going to do is we are just going to inspect your hair. And when you're inspecting the hair, you're going to look for things such as nits, dandruff, or see how fine or how coarse the hair is, see if there's any lesions or anything like that. All right?
Okay.
All right. Just gonna look at your hair. Okay, and her hair doesn't have any nits in it. There's no dandruff that I see, and her hair has nice color all around. There's no gray or anything, and then it's very coarse, so that's nice. Alright, and then now we are going to inspect the eyes. So I'm going to see, if you look at me, that they are symmetric. Could you close your eyes and then open them real fast? Alright, there is no leg lag, that's what I was looking for. And now if you could follow my finger with your eyes, but don't move your head, okay?
Okay.
All right, and there's nothing wrong with your eyes there. So now I'm just going to look at your pupil size. And they are about a 4, so that's very nice. It's a nice pupil size. And then one of the last things I'm going to do is I'm going to check to see how reactive the pupils are. So if you could look straight. All right, and they are very reactive. So the last thing that I'm going to do with the eyes is I'm going to use the ophthalmoscope, and we are going to look. We're going to look using this. All right. Right, and then the last thing we're going to do is we are going to look at her conjunctiva and her sclera. So I'm going to pull down in your eyes. I'm going to ask you to look up, okay? So her conjunctiva is a nice and healthy pink, and then her sclera is white, as it should be. All right, so the next thing we're going to do is we're going to move on to the nose. So if you could look at me. All right, her nose looks very symmetric. Do you have any congestion or any pain?
No.
All right, and then I'm just going to look up your nose. Is that all right?
Yeah.
Okay, everything seems intact up there, and it's a nice color. And then now we are going to assess the smell. alcohol. This is alcohol. Alright, so the next thing that we're going to assess is the mouth. Her lips are a nice color. They're very moist looking. They are not dry. There's no cracks or ulcers. Alright, and if you could open your mouth, please. Everything inside her mouth is a nice pink. It's very moist, and all of her teeth are there, and her gums look healthy. Alright, and so now we are going to inspect the neck. So what I'm going to be feeling for is first her lymph nodes. And her lymph nodes are fine, there's no swelling or anything. So I'm going to go behind her and then feel for her thyroid. And again, her thyroid doesn't have any swelling, so that's good. And we don't want swelling. Alright, and then now looking at her skin, you know, it's all the same color. There's no swelling that I can see. We're going to test the edema. So I'm going to press down. And do the other side. There's no edema. We're going to test for skin turgor. Alright, and her skin turgor seems fine. Next, we are going to listen to her respiratory or her lung sounds. So I'm going to take my stethoscope. Alright, and we're going to breathe in. I put this on you, okay? So if you could breathe in. So go a little further down. Alright, now lift your shirt up. Is that okay? Okay. And I'm going to go behind and do the same thing. So I'm going to lift her shirt up. Alright, and when I was listening to her respiratory sounds, they were all normal. I didn't hear anything adventitious, and there were no brutes that I saw. And before we move on to cardiac, I forgot to look at the ear, so we're going to get that out of the way first. So I'm going to palpate the auricle. Do you have any ear pain or ear tenderness?
No.
And do you have any like infections from the past, or?
I've gotten ear infections before, but
And you fixed
they're
it?
gone away. Yeah.
Alright, so I'm just going to take a look using the otoscope. I'm going to place a cap over this. Hold your ear back and look in. Alright, and then we're going to do the other side. Alright. And we're looking for the tympanic membrane in there, and that's like a nice, like orangey, almost a hint of red, and she has a healthy tympanic membrane. Alright, so now we're going to move on to the cardiac, and I'm going to listen for those sounds, starting with the aortic valve. Alright. So we're listening to the aortic. Now we're listening to the pulmonic. And now the tricuspid. And then I'm just going to go over your shirt. For the herbs. And then last is the mitral. All right, and her heart sounded very nice, very healthy. There was no extra sounds that I heard. And now we're going to test using it in the back. And what I'm going to do is I'm going to have to ask you to breathe in, and then I'm going to test your chest expansion, okay?
Okay.
All right, so could you please breathe in? Okay, and her chest expanded normally. And the last test that we're going to do is check for firmitis, and I'm going to have you say 99 when I place the stethoscope on your back, okay?
Okay.
I was like, what did I do wrong? All right.
99. 99. 99. 99. 99. 99.
All right.
Still standing.
All right, and everything was normal for the firmitis check, and the chest expansion was also normal. And so I think that concludes our physical examination. So what I do is have her lay in bed, and I would lower the bed, raise the rails, put the call bell in, and see if she needed anything done. All right, are you good?
Yes.
All right, thank you.